Scaling is all about achieving long-term profitable growth, not just a quick burst or spike. Think about how your solutions can create ripple effects throughout the public health system. The goal is to move from solving individual problems to strengthening entire systems. Greetings, everyone, and thank you for joining me on this episode. Welcome to the Public Health Entrepreneurs Podcast. This is where visionary leaders who are ready to transform public health and healthcare through innovation are welcome. I'm your host, Dr. Charlotte Huntley, and as a public health entrepreneur with over 25 years of experience in healthcare and public health, I understand the unique challenges and opportunities that come with bridging multiple disciplines. I want you to know that if you are a high-functioning leader with expertise across different fields, whether you're a medical doctor, a dentist, or pharmacist who also has public health degree, or a public health doctor who also has expertise in another field, or any other interdisciplinary professional, you know what it's like to see opportunities that others miss. You're in the right place here. I know that you understand the gaps in our current systems and you have ideas, and a lot of you have some really good plans about how to make things better. Sometimes having these unique perspectives can feel a little isolating, especially when it seems that others aren't as excited about your ideas or as open to them, or will actually kind of just outright reject them. I understand it all. It is why we focus this podcast specifically and especially throughout this recent series of episodes for you. We want to provide you with the type of support that you need. All right, so in today's episode, we are going to take the discussion from the previous episode about scaling your business a little bit further. We're going to go a little bit deeper and discuss moving beyond individual impact. What does it mean to scale your business? So let's really make sure that we're all on the same page. The essence of scaling is to find ways to take on more customers and clients who want your products and services without significantly adding to your business systems or overhead costs. Scaling is all about achieving long-term profitable growth, not just a quick burst or spike. So I'd like to focus on following key points. Now, I take notes because I can really digress on any of these topics and go really down a rabbit trail. But for the sake of this episode, I take notes, these episodes, all of them, but right now I'm taking notes. I want you to know there's some key points that I'd like to discuss with you as it pertains to scaling your business. We're going to talk about identifying opportunities for broader impact, systems thinking. We're familiar with that in public health, but what about public health entrepreneurship? We're going to talk about building scalable solutions and managing growth while maintaining quality, as well as creating sustainable business models. I'm also going to share with you 3 specific scaling strategies. Are you ready? Let's dive in. Let's talk about identifying opportunities for broader impact first. All right. So expanding your reach as a public health consultant is really what we're talking about here. So right now you might be working project by project, helping organizations develop health education programs or conducting community health needs assessments. But imagine multiplying your impact even tenfold. Start by analyzing your current consulting projects. Which solutions could benefit multiple communities or multiple organizations? For instance, if you're repeatedly developing workforce or workplace wellness programs, consider creating a scalable framework that organizations can implement without your guidance. Look for patterns in public health challenges across different clients and communities. Could your expertise in tobacco cessation program development become a comprehensive toolkit for health departments nationwide? Well, food for thought. The key is to identify which aspects of your work can be systematized and replicated. Okay. This is exciting for me. I'm a very strategic person, so I get very excited about these types of strategies and putting a business together to be able to scale. Let's talk a little bit about systems thinking in public health entrepreneurship. As a public health or as a group of public health consultants. We're already trained to think about health and at a population level, but let's apply that same thinking to scaling your impact. Map out the entire ecosystem where your expertise adds value. Are you primarily serving local health departments or community-based organizations or academic institutions? Understanding these interconnections helps identify leveraging points for broader impact. All right, let me give you an example. Instead of conducting one-off program evaluations, you could develop an evaluation framework that builds capacity within organizations. Think about how your solutions can create ripple effects throughout the public health system. The goal is to move from solving individual problems to strengthening entire systems. Are you excited about that? I know I am. Let's talk a little bit about building scalable solutions. So for public health consultants, scalable solutions look different than other industries. You are already aware of that. It's about creating frameworks, tools, and methodologies that can be adapted across different contexts while maintaining their effectiveness. Start by documenting your most successful approaches. Think about that community needs assessment methodology you've been refining over years. Well, transform it into a digital toolkit with templates and training videos and implementation guides. Consider developing online training programs that complement your consulting work. Thinking of a couple of examples that come to mind of people that I've worked with over the years. I helped them to initially build their business and they're really thriving now. And they've taken on a few of these, especially when it comes down to these implementation strategies for community needs assessments and programs like that. Once you've done them over and over and over again, you really refine and create your own system for doing that. And I know one company in particular that sells the package of, we can help you do it, or you can purchase this package and follow the steps and do it yourself if you have the capacity within the organization. So that's a great way for her to be able to help some clients, two different sets of clients, depending on their needs. It's very scalable. The key is to package your expertise in a way that allows others to implement while you provide high-level guidance and quality assurance. All right, let's talk about managing growth while maintaining quality. Quality is paramount in public health, and scaling should not compromise it at all. Create what is some people refer to as an impact assurance framework. This includes clear success metrics for your interventions, standardize your evaluation tools, and quality checkpoints. If you're scaling a community health worker training program, for instance, establish core competencies that must be met across all implementations. Build in feedback loops, regular check-ins with implementing organizations, outcome monitoring, and continuous improvement processes. Remember, your role shifts from direct implementation to quality oversight and strategic guidance. All right, let's move into creating sustainable business models. Sustainability in public health consulting requires creative thinking about revenue streams. Consider tiered service models, like I just gave you an example a few moments ago. High-touch consulting for complex projects and scalable training programs for broader reach, and at the same time, digital tools for wider accessibility. For example, you might offer intensive strategic planning services to health departments while simultaneously running a membership platform where organizations access your frameworks and tools. Look for opportunities to partner with academic institutions or larger public health organizations to expand your reach. The goal is to create multiple income streams that support both impact and growth. That is exciting. And that is something that we strive for. Once you even accomplish that, you're still constantly refining that, but you really want to go after those multiple income streams that allow you to have that impact and growth. You could really kind of summarize what I've been talking about into a type of implementation guide for public health consultants. So you can audit your current consulting services for scalable opportunities, develop standardized tools and frameworks for your expertise, create training programs to build capacity in organizations, establish partnerships with larger public health entities, design evaluation systems for measuring broader impact, and build a network of trained associates and partners. Now, finally, I want to share with you 3 scaling strategies. These are a little more specific. You can pick and choose. Like I said, it depends on where you are in your journey and your needs. And let's dive into those. So my first strategy for you is digital transformation. Convert your methodologies into digital formats. So I shared with you my own personal story of how early on I did not have the ability to meet one-on-one with people who wanted to meet with me one-on-one, who were listening to the podcast but wanted to work a little bit more closely with me. It was very difficult to work with that many, only a handful of people I could work with because I also had a full-time job. So one of the ways that I scale that was the digital transformation I'm talking about. I created online training programs. They're not exactly courses on demand, but I'm a little bit more of a hybrid. So I could bring in more people as a cohort and work with them as that I could do one-on-one. So create online training and capacity building programs. You can even develop automated assessment tools. So anything that you can do to leverage the digital technology that's available to us is a great way of scaling. All right, here's number 2. The second strategy I want to share with you is partnership development. So collaborate with academic institutions, partner with health departments, build public networks with, or really build networks with other public health consultants. You can even create knowledge products and toolkits, implementation guides, and so forth. These are, well, that kind of blurs into the third strategy. Let me go back to the partnership. Partnership and for consultants could be that you bring on a subcontractor for a project and have that consultant work with you and leverage their expertise on projects. As I move into collaboration with academic institutions, so this is really about partnership development. Make sure that you're building these networks with other consultants, organizations, and then these knowledge products. I guess that would be the third strategy for you, is kind of that example I gave you earlier where this former client of mine that I coached to get her business started, she created, after doing community needs assessments for multiple times with this niche group, she created toolkits that she could sell to organizations that had the capacity, maybe they had the team, but really maybe not the guidance on how to go through the steps to do the community needs assessments, whereas some other clients did not have the capacity at all. So where she would go in with some clients to do the assessment, bring in her team, she could sell the toolkit to others and they could implement it themselves. So creating these knowledge products or these toolkits, develop training, curriculum. I know that a lot of consultants have gone that route, right? Policy briefs, even about best practices. So those are some ways, some strategies that you can implement in this process of scaling. I think probably if I were to pick a favorite, I would say starting with the digital transformation would be the easiest way to go, because if you are right now doing everything yourself, maybe you have one part-time support, admin type of support. One of the best ways that you can scale is to incorporate any type of digital technology to help you to that can automatically do things for you. And then it also helps you at the time decide what really needs to be done and what could be cut out. So it's a very impactful step to take if you are, it doesn't matter where you are, but if you're just kind of looking to scale in the earlier stages and it's been just you, or maybe you've been in business for a very long time and it's just been you, maybe one part-time support and you're wanting to scale, that first level of scaling could easily be with that digital transformation. But the other strategies are equally impactful. So I hope this is really helpful for you. As we wrap up this episode, I'd like to remind you that I have 2 ways to support you on this entrepreneurial journey. If you're looking for personalized guidance, let's work together one-on-one. As someone who understands the unique challenges of being an interdisciplinary leader, I can help you turn your innovative ideas into reality. The second way that I can support you is if you're ready to join a community of high functioning leaders like yourself, consider applying for our premium mastermind group program. You'll connect with other professionals who, like you, are bridging multiple disciplines and creating meaningful change in public health. You can visit publichealthentrepreneurs.com to learn more. The links are also provided in the show notes. All right, everyone. Until next time, have a fantastic rest of your day.